Welcome everybody. I'm real pleased with such a good turnout, and Sarah and I put together a nice presentation with a lot of useful practical tips that we hope you'll get a lot out of this hour session. So today is all about self-care, specifically for your mental health. That's the first webisode of our spring cleaning series. So that's why we brought Miss Sarah Aberhart here. So Sarah, welcome.
Hello. Hello.
Why don't we get started with just letting everyone know your background and what you're up to these days with the CMHA.
Yeah, sure. So I work with the local CMHA here in Sarnia Lambton. I am going on my 19th year with that organization. I started out originally working in Toronto, doing some youth outreach and some street outreach with homelessness there. Mainly focusing on with CMHA. I've done a few different roles, mainly working on the crisis end of things, but recently transitioning into working in the justice system. And I also have had a wonderful opportunity to partner with our local Sarnia Sting organization in the OHL and be part of what they call their mental health coach. So assisting all the players there with kind of just being mentally ready, mentally prepared, assisting with stress management, those kind of things, some suicide awareness with that team as well. So working a lot, like I said, kind of on the crisis end of things, initial intake, getting people into services, helping get them connected to the right supports.
Wonderful, wonderful. And topic for another day, but it is just interesting to even hear your work with the Sarnia Sting, which of course for anyone out of town is our local OHL team, and they unfortunately didn't have a season. So I'm sure, a lot of those guys on the team were reaching out to you.
Yeah, it was a difficult season, definitely for them and for everyone across the OHL, but hopefully they felt supported and hopefully they get to do wonderful things next year.
Yeah, agreed. And wonderful support that you give them. And then I guess I'll introduce myself. I'm Dr. Blake Pearson, family doc who specializes in cannabinoid-based medicine. And in that realm, there are a lot of patients we see with mental health issues, chronic pain, sleep disorders. So certainly the mental health in our area of cannabinoid medicine is a big area of focus. And so I have an outpatient practice where I see patients virtually now with COVID. And I also see a lot of patients in long-term care. So in addition to treating a number of mental health patients, I work with a lot of patients with dementia in the long-term care setting. So that's just a little bit about myself. I'll move into a little bit of housekeeping. So for tonight, there is that Q&A button, which I encourage you to use. We won't get to the questions live. And same with so that'll kind of get pooled and collected, and we'll do hopefully a good Q&A at the end. And so that's where we encourage you to use the questions. Don't worry about raising your hands, that function. And then as far as the questions that everyone submitted beforehand, what we tried to do was really tailor the presentation to address some of those questions that you had sent in. So thanks for giving us your questions and your feedback. And as always, we can't exactly get into personal medical advice. So if there are more personal questions, we have to kind of stay away from that. But certainly we're happy to answer the more general questions. And again, with still during the pandemic, these are kind of overall strategies to help, especially with respect to mental health, but not specifically protecting against COVID-19 or anything like that. We're going to focus on mental health tonight. And the way things are set up is we'll provide a little bit of a background of kind of the current state, both kind of locally and across the country with respect to mental health as a result of the pandemic. Then we'll move into what I kind of call kind of the meat of our time together, which is more practical, useful resources, tips, both things that Sarah and I have found helpful for ourselves, helpful for our patients. And lastly, We'll touch a little on cannabinoid-based medicine because there was a lot of questions that came in before the presentation with respect to that. So of course, I'm comfortable talking about that. So we'll touch on that as well. So that gives us a little bit of a roadmap for the evening. Just here is a list of a few of the questions. Okay, so things around teens, things around CBD and mental health. Point of this though is a lot of these questions, if you can quickly glance at them, risks of COVID versus weighing our mental health. A lot of the questions were very similar. So just kind of highlights that, a lot of us have similar questions, similar issues as a result of the pandemic, and it is affecting a lot of people's mental health. So it's great that we're going to chat about it. Keep talking about it with your friends, with your healthcare professionals, because it is definitely all about open dialogue and continuing that discussion. So here we go with kind of a little self-care check-in. I won't talk too much through these next 4 or 5 slides. I just want everyone to read them and look at the imagery. I think the CMHA did a great job putting this together because it really personalizes what people are going through. And I know likely a number of us can relate. So here's the first one. So just have a look, see if any of these kind of resonate. I know certainly that that one there does for me. Mm-hmm. And then take a look here. And I'm thinking as we go through these, the idea is just see if you can relate to 1 or 2 of these. Certainly with restrictions of not leaving the house, this one certainly resonates. Yeah. And then of course, with our senior population, or not even necessarily seniors, but a lot of folks are dealing with loneliness, low mood. So again, just some imaging. I kind of wanted to have you look at these. Worried about the future, lost at school, anxious. So obviously can't relate to all of them, but just kind of even humanizes what others are going to as well. So with that in mind, I want to bring up the first poll question. And really the question is, can you relate to any of these feelings? So I'm going to launch this poll. We'll try again to make this session too as interactive as we can. And then Sarah and I are going to get into discussing some of the topics here. But first, I'm going to launch the poll. So the question is, can you relate to any of these feelings described in these images? And a simple yes or no. And we'll just kind of get a temperature check. Okay, so I'll post these results here for everybody. So I think everyone can see that. And yeah, not surprising. Most of us can relate to that imagery and those messages. And since the majority of people are in the same boat here, let's get into what's going on here locally, but also abroad. So we know this is from CMHA. Overall mental health has declined. Here's the poll of Ontarians who say their mental health is very good or excellent. And that has declined from spring to summer. You can see the winter at 35%. And this isn't to paint a bleak picture. It's just to kind of normalize things that we're all going through stuff. And Sarah, would you say that's winter 2021, but would you expect possibly even things to dip even a little bit more over the spring?
Oh, I would definitely think so. I think even heading into this next announcement of a possible longer lockdown here in Ontario, I think we're just going to see that that increase, right? The anxiety that people have, the anticipation that they have about things maybe getting better than it being taken away. Those kind of things really play on people's anxiety and depression. And I think if you were to do this poll now, we would see another huge decline in what people are saying in terms of their own mental health at this point in time, for sure.
Yeah, and I think you kind of touched on an interesting point, and that's that kind of cycle of anticipation, something good's going to happen, and then kind of more extending of the lockdown. And again, I know
Yeah.
with the hockey team, it was that kind of thing. Season might start in March. No.
Yeah.
Season might start in May. No. So it
Yeah.
really can play on people's emotions.
Absolutely, it does. It plays on my emotions. I think it's fair for everyone to say that, right? I look forward to things that I enjoy, and then know that that's going to be taken away, right? So
Mhm.
it's little things that we look forward to, and those are the things that help us in our mental health, right? So it's definitely hard for people
Yeah.
to deal with, for sure.
And then when you think about what's going on, um, maybe people aren't aware of, sure, people are feeling isolated, a little bit more lonely. Obviously, a number of different anxiety triggers and stressors.
Yeah.
Um, you're seeing that obviously at the
Yeah.
CMHA, but
Yeah.
what else do you see even with respect to things like domestic violence?
So right at the kind of on the front line of things on our crisis team, our mental health first response team, for one, it's new callers, people that we have maybe never heard from before. They're new, they're experiencing these kind of feelings for the first time, and aren't really sure what those are, right? So they're reaching out because it's scary for them to feel this way. So we have a ton of new callers, people that are reaching out for help for the very first time in their life. We have a program that is partnered with our local police services, who are seeing a dramatic increase in domestic violence, in substance abuse related calls for them for assistance, things like that, like children and parents, and the tensions are just so tight all the time, and people are wound so much that these calls are increasing, and therefore affecting people's mental health. Like it's a cycle that's really hard to break right now.
Yeah. And it's interesting that you see that the police are responding to a lot of this. Like they're certainly impacted by what's going on with mental health.
Yep.
And would you say it's correct, or part of their job now is a lot of mental health work?
Yes, absolutely. And I can speak from experience with my husband being a police officer, where the majority of the calls that they deal with on a regular basis are mental health calls. They're wellness checks. They're going to homes where, substance is a huge issue, where they're checking on people's well-being due to suicidal thinking, thoughts, those kind of things. It's a constant every day for them on the road.
Yeah.
Absolutely.
Yeah. And then in my world, traditionally, I would say my practice was more chronic pain, fibromyalgia, osteoarthritis, degenerative discs, um, sleep disorders, and of course, what I talked about with dementia. But over the last year, there's certainly, your new visits are up,
Mhm.
first time visits.
Yeah.
Same on my side of thing as well, with new mental health consults, whether it's PTSD or generalized anxiety. But it's certainly something we're both seeing.
Yep. I mean, it's a good thing people are reaching out. It's
Yes.
nice that we're seeing those first callers, and they're
Yes.
looking to talk about it. It's wonderful, but it's definitely as a result of the lockdown of the pandemic. Absolutely.
Yeah. And thank gosh, the dialogue is open. So
Yeah.
more people are talking about it. And again, with anyone who's joining us tonight, that's certainly what we encourage.
Mhm.
And as we work through this, which we're going to get to here shortly, there are a number of resources that are available. Both Sarah and I have seen the system we have, and there are some limitations with what we can provide as
Mhm.
far as resources for mental health. But it seems like there's been a big increase. More needs to come, but we're
Yeah.
going to go over some of those resources that if you can't see someone locally, there's some national outreach that you can take advantage of.
Yeah.
Perfect. Well, let's transition to the second poll question before we kind of get into some of the goods. And thought it might be interesting for everyone to just think about stress, sure, but how that can also have physical signs. And sometimes you might not be in tune with, oh, I'm actually, more stressed. You might be in tune with what's going on physically, things like digestive issues, increased autoimmune symptoms. If you do suffer from something like psoriasis, you could see plaques build up or something like that. Certainly pain is another indicator there for stress. We see pain go up. But I'll ask this poll question as soon as I can launch it here. But when you look at this, do we have any correlation with anyone joining us as far as these symptoms, both the emotional and the physical, with respect to stress? And I'll just launch that now. And the options are no, yes, a few, or even many of these symptoms. And while they're doing that, Sarah, is that something you like in the initial intake? Yep. Is that something that you guys look for as well? Of course, the emotional side, but are you addressing the physical symptoms?
Yeah, we do. We do a pretty comprehensive assessment on intake. And a big part of that is people's physical health. There's a very big correlation between physical health and someone's mental health. And like you said, it can manifest in many different ways, but we do see a lot of mental health along with chronic pain, appetite issues, sleep issues, just there's a lot of things, headaches, tension, those kind of things that are a big part of people's lives when they're experiencing different types of mental health issues. So we do focus quite a bit and do work with primary care physicians on individuals' treatment plans when physical health is an issue as well.
Perfect. And it makes sense, right? If we know the mind-body connection is real, and it's important to kind of take that holistic picture. Here's the results, and hopefully everyone can see that there. Actually, there we go. So yes, experiencing a few of these symptoms, 62%, 36%, a lot of these symptoms. And so I'm glad you're here, because this is to help. Really, again, that is the goal. A little bit of education on understanding what's going on, and of course the link between emotional and physical health. But let's get into what we can do about it, and obviously Rome isn't built in a day, but want to be thinking, hey, maybe I could take this nugget from this presentation and start trying something, or maybe I could take 2 of these little pearls and try to incorporate them. But again, just be thinking as we move through here, if anything might click for you. So when we talk about mental health, there's a number of risk factors, and there's some protective factors. Certainly, sleep is huge, and that to me is one of the biggest areas if we're talking mental health. If you can improve your sleep, whether that's through exercise, routine, winding down at night a specific way, or even sometimes medication may be needed, but that has a huge impact on the mental health. Then of course, trauma, substance abuse, some of these things obviously can contribute, not to mention genetics. So protective factors, good physical health. We'll talk about exercise, of course, good sleep. We're going to touch on that, and positive social supports. But that's just an idea of some risk factors, some protective factors. Certainly positive social supports is crucial during this time. Absolutely. Yeah. And I mean, I think everyone's hopefully trying to take advantage of our technology, our Zoom, our FaceTime, but wanted to just highlight some of those, and want to get into this last poll question to kind of set the stage before we do move into some of the more practical advice. Wanted to get a sense for actually how you currently cope with stress, or how you protect your mental health a little bit, and just see what is common for the group before we dive into some of the things that we find useful for ourselves and for our patients. So I'm going to launch this poll. And again, it's how do you cope with stress? But you can select many options if more apply. So I'll give a little bit more time. And yeah, just click on what applies to you. And I'm going to just actually quickly check the raise hand function. Again, we're not going to answer the raising the hands just yet. We'll save the questions for the end. So I just wanted to point that out there. Okay, so lots of answers coming in. And this is just kind of, again, to kind of see how people like to reduce stress at the moment. Okay, so I think we've got a good amount of responses. So let me just end that. Okay, I'm going to share those results with everyone. So the winner was go for a walk, do something physical, get outside. So that's nice to see, and we'll touch on that as well. But interesting with a lot of these, some are, we would say, is a little more productive than maybe some of the traditional vices like the junk food or beer or wine. But of course, people cope different ways. We're going to give some suggestions, but it's nice to see, get outside in nature, listen to music, and certainly, of course, too, even there's health benefits to a glass of wine. So we're not certainly trying to say that that's not one way to go about things. But Sarah, anything to add to some of
Well, I'm actually just looking at the chat too, and some of these other ones that have come up, which are great. And I think sometimes we underestimate pets, right? And spending time with pets and taking your dogs out, and I think pets are a huge piece to individual coping. And I saw, a couple of people who like reading and journaling. Those are great. A lot of good distractions there.
Yeah.
And I did see someone say they sleep too much, and that absolutely happens sometimes, right? When our mind gets too tired, too busy, we just like to go to sleep. And sometimes that's a great protective factor, and, being able to build up for the next day, those kind of things. So people have really great suggestions for sure.
Yeah, big time. The breath work, the painting, playing music, certainly can relate to that. And one of the panelists just said too, even playing music is a great form of meditation when you hit that flow state. And that is a term that I'm glad someone had mentioned, because it's a very cool thing to find that flow state when you're just basically in the zone, and a lot of the tips Sarah and I are going to go over kind of has that element of getting into that zone where, if you're playing music, that's all you're thinking about. Certainly a number of my senior patients, they'll find flow with knitting, gardening. It's just almost when you can get lost in the moment.
Yeah.
So that was really great feedback. We're gonna dive into some of our suggestions here. This is kind of some high level stuff that a lot of people actually touched on: the getting outside, the taking the breaks, the compassion for yourself and for others. I find empathy, gratitude, really helpful for mental health as well. But I thought I'd get into some of my suggestions. Then Sarah, you can have the floor.
Perfect.
And obviously feel free to chime in here.
Yep.
So one thing that I think is important, and I often recommend to a lot of my patients, I certainly practice it, and it's the idea of a morning routine. What that means, that's up to the individual, but I'll kind of share some things that I think works well. Certainly when I hear feedback from other patients, the idea of starting the morning and moving. So whether that's first thing we're getting up and we're going for a walk, but combining the exercise with nature outside is often very positive for people to start the day. Now, another thought is that that morning, even if it's 10, 20 minutes, but the idea, the conscious decision that you make to do something for yourself to start the day before moving into what can be for a lot of people the craziness of everyday life. So that idea of again, you 5-10 minutes, but deciding I'm doing this, then I can move on to work or family. But certainly a morning routine is nice. And for me, I like to add after the walk. Then I'll sit down and kind of journal a little bit. I'll recommend to patients a 5-minute journal or even a 1-minute journal. Time is not important. It's again the conscious, okay, I'm grateful for this today. And, you know, here's what might make today great, or I might enjoy this. But just kind of a couple bullet points. Doesn't have to be a large, essay, but that idea of really being mindful and kind of tracking progress, especially too, we're talking about the morning, but that idea, same idea at the end, to just end of the day, to just pause and maybe say, hey, this was good today. Or if maybe something wasn't good, or like I missed my workout or I didn't read the chapter of my book, I'll do that tomorrow because I know it makes me happy. But the idea of being present, being very mindful of your days, because I know for myself, a lot of people, days can go by, months can go by, years can go by without just checking in and evaluating, hey, was this good? Was this not? So I wanted to kind of just highlight that as a pillar of the morning routine, the journaling. And Sarah, you find too, maybe sometimes journaling at night for people is even a little better in the morning, depending on.
It may not even be journaling at night. I just think for me, as much as morning routine is helpful and positive for you, nighttime routine is important for me. I need to set up for that perfect night's sleep, right? Or try to get myself that night's sleep. You've
Yeah.
mentioned before how important it is for a good night's sleep for mental health to be, successful, right? So whatever that looks like for somebody, but for me, it's like finishing with a show that I enjoy. It's my personal care routine, like washing my face, brushing my teeth, turning off my screen, like no phone, those kind of things, no TV for a period of time before bed. So for me, it's a lot about making sure that my mind is calm enough to be able to get to sleep and have a good sleep to make my morning a good morning.
Yeah.
And then in terms of the journaling, you touched on it. It just doesn't have to be like a big story, right? It can be 1 or 2 words. It can be feelings. It can be a sentence. It can, it's whatever you're feeling in the moment. And sometimes it's just scribbles on a page, right? It doesn't have to be a
Mhm.
big thing, because sometimes people feel like they have to write a story and that becomes cumbersome and overwhelming. So
Mhm.
it's just to
Yeah.
get the thoughts out of your head and onto paper, right?
Yeah.
No matter however you do that.
Yeah. And it can be daunting if you're thinking, gosh, I've got to write the whole page. Um, Bullet point works just fine. And
Yeah.
what you'll find as you progress is you probably will get a little more comfortable with your thoughts. And then you will start to maybe put together some sentences, but right out of the gate, um, yeah, small is best. And that kind of leads me to the tiny habits idea. Um, but I wanted to just go back to the idea of the nighttime routine. That's another opportunity to be mindful. So it's,
Yes.
that's if it's in the morning, okay, it's taking the time. I'm doing this at night. You're taking that time, you're consciously deciding, I'm going to progress with watching my favorite show, whatever it is. But just that
Yeah.
idea, of just thinking about it and just being intentional.
Yeah, absolutely.
So when it comes to the Tiny Habits idea, and this was a great book by BJ Fogg. So if anybody wants to have a good read, and it's super useful. And I'll kind of highlight the example with, let's say, a morning run or walk or journaling. So the idea of and Sarah's going to give some other tips too, but like if you're going to incorporate any new habits, which essentially that's what we're talking about, start small. So let's say you never go for a walk in the morning, but you've decided that makes sense. I'd like to get out, move my body, be in nature a little bit. Well, the key to success in that scenario is just starting very tiny. So that could be as tiny as just going out the door and coming back the first day. That could be, all right, day one, I'm going to walk a block. Tiny. That's the key. Then you do that each day, you keep the habit going, and then you expand to 2 blocks, 3 blocks. But the key is to keep the habit intact. So on a day that you just don't feel like doing it, maybe you're 10 days in, you have progressed and you just don't have the desire one morning, get out and just walk outside and come back in, and you've kept your streak alive, and celebrate. That's the other part. Every time you do that new habit, really feel good about it. Feel it, because that'll lock in that behavior. And it might sound silly when you don't want to walk to just go outside and do, 10 steps, but it really does keep that habit intact, and really important. So that's all I have to say about that idea of the tiny habits. It's really useful. And then the last thing I'll just say is mindfulness throughout the day, meaning transition moments. So you don't have to meditate all day. You don't even have to meditate for 20 seconds. But when you get up to just change whatever activity, if it's going from work to home, or you're putting the dishes away after dinner, transition moments where you can pause and just reset. Sarah's going to talk about grounding, so I won't go dive into that. But when she's talking about grounding, that's what I mean. Like at transition points in your day, ground, kind of listen, feel, reset. There's multiple moments throughout the day where you can do that. And it is very helpful to take even 5 seconds to do it. So with that, I will pass the ball to you, Sarah.
Thank you. So yeah, Blake has a lot of good strategies kind of to take you throughout the day. A couple of mine are more kind of in the moment things for me, that when I notice my anxiety starting to kind of creep up on me, or I'm starting to feel overwhelmed by a situation, what do I do? But first I'll kind of talk about my daily exercise. I need to have that in my day. I can tell you throughout this pandemic, my daily exercise routine has changed dramatically. I've been able to be at my gym and then not be at my gym, and then back to my gym and not at my gym. So the yo-yo effect for me in terms of that kind of a routine it's been a struggle for me, but I'm trying to build it back in. I was very much a morning workout person, come home, get ready for my work day, where now my physical exercise is more coming at the end of my day, and I'm choosing to get up, have a cup of tea, and do a little bit more quiet time in the morning before starting my work day. So the yo-yo of that has definitely played on my my mental health, for sure. I enjoy being at the gym, but it's so important to me to get it in somehow throughout the day. So I've maintained that. Blake talked about grounding, and it's something where it is absolutely needed throughout the day. It's, there comes times throughout your day where you maybe had a frustrating conversation, or you're feeling your anxiety creep up, and just being aware of your surroundings and grounding yourself back into that moment is extremely important. One of the tips that I often talk to people, on the crisis line about, or utilize myself, is a really simple one. It's just the 5 senses. And it really is effective in bringing yourself back to that moment and making you aware of where you are in terms of your surroundings, because your mind can take you many, many places, and we want to be able to come back to where we are. And 5 senses is pretty simple. It's something that you can do pretty discreetly. And it doesn't have to be something where you're kind of out there for everybody to be like, what is that person doing? So just to kind of briefly say what it is you go through your senses. So 5 things that you can see, 4 things that you can actually kind of physically touch. If you don't want to get up from your chair, then it's your chair, your legs, like different things around you that you can easily touch from where you're at. Things that you can hear. So that's really going to kind of bring you into focus. So hear around you. 2 things that you can smell. So that sense of smell, just really kind of searching for that. And the last thing is a thing that you can taste. So if there's not something really there that you can do, just imagine something that you enjoy the taste of to kind of bring that, that sense into your awareness. And I like to end it with just a couple of really big kind of deep cleansing breaths to kind of bring you back to that situation. And I find that it really brings you back to the moment and it helps bring those thoughts down. It brings, that level of intensity down of what your body was feeling. So I find it pretty great.
Yeah.
The other one for me is music. As soon as I start to realize that I'm going 1,000 different directions, I put my headphones in and I can focus. So I get that one task done. I work in a busy office where there's lots of noise around me. I get frustrated and flustered by that, put the headphones in, and I'm able to focus. It really brings me back to being able to focus on what I'm doing. So those are kind of my go-to strategies when I'm starting to feel pretty overwhelmed.
I love those. And I think a lot of people can relate. Certainly, the exercise for me, just personally, same thing. I find that it's very obvious to me if like I'll get anxious or my mood will dip if I don't get active, whether it's one day or maybe 2 days in a row, but it's obvious.
Yeah.
And I love the grounding, and I kind of I would say for anyone who wants maybe a little cheater tip that I use, if you can't do all 5 senses, the one that I find the most effective is the hearing. And that's just me personally, but something as simple as cracking the window of your office, or if you're able to have a window or you're at home, really that listening and hearing birds outside or different sounds, again, using your hearing to ground. Okay, now you've stopped thinking about basically whatever it is maybe you're anxious about, but it allows you to pause. And I was talking about the transition moments, and that is one where you can easily just tune into your hearing,
Yeah.
present, right, and then move on. Cool. Well, I love the grounding. And is that something you work with patients on too?
Yeah, I find it to be a really good one for me. Like I said, I think it's a very practical grounding skill that you can do anywhere. I know I've even spoken to some of the Sting hockey players about it, right? Like
Yeah.
people that were finding even mid-drill on the ice, they were feeling anxious. So I'm like, okay, so let's say, you can't do all 5, but what can you pick out to bring yourself back to that moment, right? So the skates on the ice, going over and taking a drink of the water bottle, different things like that
Yeah.
in the moment is pretty effective for people.
Yeah. Well, I could picture that. You're in line for a drill, and I used to mess up the odd drill back in my day. So I could see that being useful, because there's real-time anxiety on the ice for those guys.
For sure.
I guess to kind of, again, we kind of delivered a lot of info to everyone there. And what I would say, we're going to go over some of it again, but common themes just with all of this that's really nice to know is a lot of this stuff doesn't take a lot of time. It does require attention and being present and being intentional, but doesn't take a lot of time. A lot of this stuff is free. And you just have to kind of mark it and set aside the time to do these things. So there's some of the positives with this stuff.
I think too, Blake, I think you'll probably include it in your resources, is that there are a lot of great apps that can help people, guide people through these kind of things, right? So there are a lot of free resources that if you don't know what grounding is, or you need to be guided through some breathing, different things like that. There's lots of great apps out there that will definitely be provided as resources for sure.
And speaking of resources,
Good segue.
all right. So let's dive into this, because that's a lot of practical stuff. But if you're thinking, yeah, I might need a little bit more formal help with things, let's first talk about the Bounce Back program, because it is fantastic. So walk us through a little bit about Bounce Back.
Sure. So Bounce Back is a program that was developed by CMHA Ontario, which actually recently has been provided with funding through the Bell Let's Talk campaign to reach more nationally. So it's is across Canada. It is a online based program. They have two streams. They have one for youth. That age range is about 15 to 18 for the youth program. And then the adult program is 19 and up. Bounce Back is a cognitive behavioral based program that really focuses on practical life skills to help you learn how to manage your depression and anxiety, stress, worry. So it's a lot of really practical learning. You can do this through online coaching, where you are connected with a coach and you get kind of phone calls, chats with that individuals. You're doing a lot of online video work. There's workbooks, homework, those kind of things that you do. And then you check back in with your coach and you kind of work through the program. Sometimes people don't feel like they're necessarily ready to do that coach stream yet, but there is a stream where you can do just the videos and kind of do it at your own pace and work through it on your own level. So there's two avenues that you can look at through Bounce Back. Typically, they do want you to be connected to a primary care physician, but you can self-refer into the program. You don't need to have a physician referral into it. It's been a pretty successful program. There's no wait time. So right now, where some of the more local sources might have some pressures of wait time, there's no wait time right now to get connected with a Bounce Back coach. So I definitely encourage people. I just saw it kind of pop up on a question there. Bounce Back is free. There is no charge for this program whatsoever. So, it's accessible to anyone and everyone. And I do encourage people to look into it if they're struggling. It's very practical, very great in terms of teaching kind of and working through some of those coping strategies.
Yeah, and so nice that you've got the option, the videos, or a little more hands-on with a coach. It's fantastic.
Yeah.
And then there are resources for teens, and we kind of talked about this too. A lot of this, there's a lot of crossover between what we're talking about with even the grounding, journaling. That sometimes you do need specific things for teens, but a lot of it is the same stuff we're talking about with their parents.
For sure it is. And I think something that we kind of talked about earlier is that, maybe create that time for check-in. I think a big thing for youth is being able to feel comfortable and having that conversation with them. So checking in to see how they feel, naming their feelings, allowing them to have that conversation is really important. So as a parent, if you're comfortable having a conversation, they're going to be comfortable talking back with you. So, working through some of these skills together, going for those walks together, different things like that is really important.
Yeah. If you're not doing it, or mom or dad's not doing it and is about to start, include your kiddo. That makes great sense. I was actually talking to someone who's about 17, and there's a good health coach in Toronto who has this great program. But it was the mother and the daughter signed up together, and daughter had been doing a lot of online learning, and at university, she wasn't even having any live classes, so there was really no schedule. She had to do the modules and things like that for her class, but she just wasn't in any kind of routine. And what she found real helpful was her and her mom joined this program. It was 9 a.m. every morning virtually. But she really found having that structure to start her day very beneficial. Yeah, really just highlighted kind of the power of having that structure and doing those activities together. Okay, so we'll switch gears to another great resource, another free resource. And with this Wellness Together Canada, it's also fantastic. You've got free mental health and substance use support. There's actually like the crisis line that you could call, and they actually have free live counseling for adults and youth via text or phone. So again, we know the resources here and across the country are limited when it comes to kind of counseling. Again, we need more funding for mental health, but really, really nice. This was funded by even government, but also private industry. So if there is a need for counseling, this is another great option. But like Bounce Back as well, there's some modules and tools to use, courses to work through, learning about the anxiety cycle or anxiety triggers, leading to avoidance behaviors and breaking that cycle. But it's really tailored to specific groups as well. They have, I think it's broken into 4, here it is, yeah, the 4 different groups. We've got adults, there's a youth line, so you can see the numbers there, and all of this will be in the resources. Phone numbers up here for the crisis line or the counseling line. Then you've got frontline workers, which a number of folks joining us tonight are on the front lines. So they have their own dedicated line, and then of course, Indigenous peoples as well. So 2 great resources. So just wanted to highlight that for everybody. And when it comes to the little kiddos, even it's a little bit different. There's not as much out there, but came across this on Instagram, Kids Emotions Coach in the UK. Lots of free resources on the website and her Instagram page, a whole back to school after lockdown. So you can check her out. That's jennyhoneyben.com. But really neat resources for younger children. So just wanted to quickly highlight that as well. All right, so we'll move on because we're getting tight for time, and we want to make sure everyone gets as much out of this as we can. So we kind of built this with the approach of kind of how we practice, with really the holistic viewpoint, and exhausting some of these resources, really working on ourselves. Sometimes though, that isn't enough and we need to seek further help. Certainly the idea of the 3 Ds, duration, the disability, distress, but really simplistically, when to seek help is if it's affecting your daily life, if we're not functioning well, if we're missing work, relationships are getting strained, that would be the time. And is that kind of it in a nutshell there, Sarah, would you say?
Yeah, for sure. And I think that's when we see the people reaching out, right? Is when it has started to, teeter into that where this self-care is just not enough, where I feel like I need to, reach out, but I don't know where I need to reach out to. So that's what we're here for, whether it's us, whether it's primary care, absolutely.
Yeah. Yeah. So if someone decides, okay, try to view the resources, and like we said, some of the 3 Ds, or it's impacting life in a greater way, and they want to reach out to the CMHA, walk us through that.
Okay, so first I just want to say that I am speaking about CMHA here in Lambton, Kent. So these are the services that we offer here locally. However, CMHA is a national organization, and as much as services may be similar, they're not always going to be the same. So really, I encourage you to reach out to your local CMHA to see what's available. And I'm sure they are like us. If they're not the right place for what you're looking for, they will put you in the direction of the right place. We would never say to someone, sorry, we can't help you, and that's that, right? We always put them in the right direction.
Yeah.
So I can speak kind of on our end. So anyone can refer into CMHA. It does not need to be from a primary care physician or from a psychiatrist. It can be, you can call yourself, you can have a family member call, you can, if you are a friend of someone who's struggling and you want us to reach out to that friend, we can do that. So we kind of start with the intake process, which is you're connected to through our mental health first response team. that is your way into our organization. We do a pretty healthy intake screening and assessment to work with you to figure out what your goals are. So whatever you decide you want to work on, we base what programs we have to fit your needs. And like I said, if we're not the right suited place for you, we will make sure you get connected to that right place. And we won't let you go until we know that you're there, right? So we're going to make sure that you're connected and you're doing what you need to be doing. We have case management supports that, is a really goal-focused program. We work with individuals with bipolar disorder, schizophrenia, major depression, different things like that. We have our psychotherapy-based programs, our cognitive behavioral therapy, our dialectical behavioral therapy, early intervention. So that is a youth-focused program for individuals who are struggling with a first episode of psychosis. And we work in geriatric mental health as well. So we work with individuals with both substance use and mental health illnesses as well. So we kind of have a full scope of different things that we do. But like I said, your first step is reaching out to our mental health first response team, talking to them about what your goals are, what you're looking for in terms of support, and we will get you where you need to be.
Perfect. So get started with that first response team and they're going to steer you in the right direction.
Yeah.
Perfect. Okay. So that's obviously on the CMHA side. And sometimes, then even medication is necessary. And again, we left this last because I really believe in more of that holistic picture, certainly working through those things. And sometimes with mental health, medication may be needed. So at that point, your next steps are likely working with your primary care provider first. And, obviously primary care docs are well trained in this. That's what I did for many years. And that was a common theme that we deal with. So they might use tools like the GAD-7, which is a generalized anxiety screener. They might use things like the PHQ-9, which is a way to assess mood, but they'll use some of these validated tools to track your progress. What could you do? Some of the stuff that we already talked about, if you want to kind of track your progress, then things like, again, light journaling, how did it go today? What would I change? Good day, bad day, real short point form. But that would be something that you can do on your own. In addition to the physician monitoring your symptoms, you can be very involved. And again, that's one of the key messages tonight is being present and intentional. So tracking how you're feeling is a big part of that. So when it comes
I can jump in here too. I just wanted to say that it's important to know that CMHA is also going to help you have the conversation with your doctor. So sometimes people aren't comfortable or don't know how to bring up that conversation with their doctor. Well, we can make that a little bit easier for you and assist you in that conversation. We can provide letters, documentation. We can attend doctor's appointments with you if that's what's needed, right? So if your first step is us, we will make sure if medication is needed, that conversation happens with your primary care physician as well.
That's wonderful. So many resources. And it is nice when, like, if someone is a little bit more hesitant about that, to have that support. Certainly I've seen a number of patients with their CMHA support. And I always find it very helpful too, as a physician. So when we're talking about what medications might a physician use, typically for depression, anxiety, oftentimes you'll see a selective serotonin reuptake inhibitor, or the SSRIs are generally first line. Again, after we exhaust everything we discussed, that might be an option. And then, of course, with what I do, I'll get referrals usually after maybe someone's failed an SSRI. We don't want to use the same class again if we didn't have good results, or maybe not able to tolerate due to side effects. Then what I'll typically use for anxiety or mood would be a high CBD formulation. Generally, we stay away most of the time starting out with THC, but CBD can be helpful. It also works on a serotonin receptor. But whether it's an SSRI, whether it's CBD, the big picture in looking after exercise, nutrition, counseling, CBT, cognitive behavioral therapy, all these things together will give you a much better result than just CBD or the medication. It's all of it together. So I wanted to note that. And because there was a lot of questions on cannabinoid medicine that came in, I thought I would just quickly kind of address some of the ones that came in. So we'll kind of rapid fire these. So is medical cannabis safe to take with antidepressants or sleep medication? Kind of depends on the sleep medication or the antidepressant, but in general, yes, we oftentimes I'll see patients that are on, again, an SSRI, and we'll start a CBD formulation and then wean that down, or they're on a sleep medication like a zopiclone or a benzodiazepine like lorazepam, and we're moving away from those medications because of their long-term risks. So yes, they can be taken concurrently most often, but generally when we're doing that, it's to start something different and then wean that other medication down. Sometimes we keep it on board. Certainly if it's helping and we just need to maybe improve things a little bit further, they can also be taken together, specifically the SSRIs there. When it comes to, can medical cannabis be taken with a heart medication? That's a broad question because there's a number of different medications that affect the heart. The important thing to know is, yes, if someone has high blood pressure or something like that, yeah, you can use cannabinoid-based medicines with those medications. The medication you want to watch out for is if you're on a blood thinner like warfarin or Coumadin, the CBD can inhibit the metabolism of that specific drug, leading to higher levels. So you have to check your INR when you're on warfarin with CBD. You check it anyways when you're on that medication. But that would be one to point out. And THC in high doses can increase heart rate. So at the low starting doses, you don't see that. So it's usually not much of a concern. But if someone were to take a high amount of THC and they've never used that and they have a heart condition, well, that can rapidly elevate the heart rate, which is concerning. So there's some things to think about when it comes to cannabinoid-based medicines with respect to drug-to-drug interactions with underlying conditions. So wanted to highlight that. Another question was who should not take it? So that really comes down to the absolute contraindications, which are schizophrenia, psychosis, and pregnancy and lactation. So those are where we don't use cannabinoid-based medicines. CBD is appearing in some new literature to actually be positive for schizophrenia. That's CBD, not THC, but more research needed there. And drug-to-drug interactions. Talked about warfarin. There's another anti-seizure medication called clobazam, which can lead to further sedation. So if patients are on that medication, that's one to watch out for. Real quick here, when using medical cannabis for anxiety, is it better to vaporize, smoke, or ingest? No smoking, because that's not the healthiest way to go about things. So we certainly don't encourage anyone to smoke cannabis. When we're managing anxiety, we always use essentially the oils or a capsule. And again, high CBD because we need people to function. We want them working. THC at nighttime for some patients. But when it comes to vaporizing versus ingesting, I would just say we use, again, the oils because it lasts for 6 to 8 hours. So you can have a dose in the morning. And then when you get home from work, if anxiety is still an issue with family or stresses from home life, an afternoon dose because of that long half-life, 6 to 8 hours usually. When someone vaporizes cannabis, that works instantly within seconds, but it only lasts for an hour. So it's really not practical if you have anxiety throughout the day to just keep vaporizing. So that's where we use CBD dominant and oils and capsules for that. What's the biggest benefit to using a cannabinoid with respect to mental health? Okay, so a lot of gray area with cannabinoids and mental health. The literature, there's some budding literature with respect to anxiety, but clinically, the biggest benefit that I see in the patients I treat is if they they have good sleep hygiene, but they're just not sleeping. They have a great nighttime routine, but they can't sleep. And there's a lot of patients like that with PTSD or chronic pain or generalized anxiety. Using cannabinoid-based medicines at night for sleep, really, if you can improve someone's sleep, it has a very positive benefit on their mental health. And that's clinically, certainly I see that. And there's some evidence where they compared getting a good night's sleep basically to an SSRI, and not surprisingly, improving the sleep outperformed the medication on the Hamilton Depression Scale. So that was a brief rundown on some of those questions, a couple common questions that repeated, so we included them in there. Hopefully that all made sense. And now we will wrap up and hopefully get to some questions because we ran over time a little bit. But so who can help? We talked about it. So definitely your primary care provider. Want to start there. CMHA, like Sarah said, you don't necessarily need a referral from a primary care provider. They certainly can help. So primary care provider, CMHA, if you do have a benefits program, you can take advantage of those counseling services. There's local addiction services department. Of course, us at Pearson Health, happy to help, and certainly have a passion for it, enjoy doing it with our team. So there's some resources, and of course with the list you're going to get emailed to you, there'll be local, but also national, international resources for all of our guests across the country and in other countries. So be sure to check that out. Before we kind of let you go or open it up to questions, we just had a couple essentially parting thoughts or Cole's notes from tonight. So Sarah, take it away.
Yeah, so I think it's just important to recognize, and I know we hear it all the time, is that mental health can affect anyone at any point in time. Like mental health concerns, issues, stresses don't discriminate. So everyone is at risk. So it's really important to build in those self-care skills, but also know that self-care takes practice and that it doesn't have to be the biggest things. Even small things can make changes. And like I said, just practice, keep it up. Don't give up after one time of it not working, right? And sometimes it's a process of elimination. You try something a couple times, it doesn't work, move on, find something different, right? Just a little bit of a hashtag from coming off of Mental Health Week is just to name it, don't numb it. So name what you're feeling, don't push it down, talk about it, have a conversation about it, let people know what's going on with you. Put a name to your feelings, and it's amazing what that does for you.
Yeah, I love that hashtag and the slogan for Mental Health Week, because even though it's short and sweet, it really kind of accomplishes a lot. And I think it's so important to name it, because that requires, again, being present, right? Understanding your feelings. Whereas the numb it, okay, or whatever, I'll just move on. And if it's okay to feel anxious, it's okay to feel angry, it's okay to feel upset, but be aware of it, acknowledge it, and you will be better off for doing so.
You will sleep at night.
Yeah, exactly.
Yeah.
And then on my side of things, treat the brain like your body. So, a lot of you work out, exercise, right? But this needs to be worked as well. And some of the things we suggested can do just that. And your brain is just so important. Your mental health is so important. So it is time well spent to invest in it. So that'd be number one. Kind of to echo what Sarah says, it's certainly not a one size fits all paradigm here. Mm-hmm. We gave a lot of resources. So maybe you'll take the journaling thing and run with it. Maybe you'll take the morning routine, or maybe you'll start walking in the morning through the park. But if it doesn't fit, that's okay. Move on to the next thing, and maybe you'll find something that does. When you are trying these new things, again, back to the tiny habits, just start tiny. The example again of the walking program. Get out the door the first day, a block, maybe the next week, every day, just a block. Progress. You don't want to walk the one day, just go out the door. Keep the habit intact. Another important piece to this new habit formation, anchor your habits. So anchor meaning if your walking habit starts in the morning, what's something you do every morning that you can anchor the walking to? So maybe it's brushing your teeth. So I will, after I brush my teeth, I will go for a walk. And as you're brushing your teeth, that's the cue. Yep, then I'm going to go for a walk. But any new habit should have an anchor. If it's in the evening, after I wipe the table down from dinner, I will do this. But any new habit, think, what can I anchor this into my routine? And then, of course, the key after you're done for the walk, whatever it is, however you want to celebrate. For me, I like a good fist pump. You may want to put on your pump up tune or some type of music that really makes you feel good. But that will lock in the habit. So every time you come in from that walk, crank your theme music, pump your fist. That will really create a positive feeling and really reinforce that new habit. So don't be scared to celebrate every time you do it. So that is all we have for you. What's next is, here's the email. It's chock full of what we discussed, but also additional resources. So there is plenty on there. And again, not to overwhelm you, but to give you options and see what works. Coming up next, we've got our Webisode 2. That's in 2 weeks, Thursday, May 27th, same start time. So we're going to be looking at still the spring cleaning theme, but we're going to be taking a look at your medicine cabinet. So ways, without having maybe some people having annual physicals or things like that, just reviewing, the idea of using multimodal medications like cannabinoid-based medicine to reduce polypharmacy. So I'm going to have on a geriatric pharmacist, as well as kind of bonus, we're actually going to bring on a co-researcher of mine, Philippe Lucas, who is going to share some of the results of our recent study, which looked at cannabinoid medicine in patients 50 and older, because there's not a lot of evidence in that patient population. So we're going to be sharing with you some of our preclinical or pre-published work. And Andrew Donald is going to join us, who's the geriatric pharmacist as well. So that should be a great event as well. So tune in, and that's it. So we can open up the questions, but before we do, Meredith.
Yep.
Because I sometimes we can end abruptly with the questions. I want to make sure we thank Sarah. So thank you, Sarah. That was fantastic.
Thank you. Thank you for having me. I was nervous, but thank you so much. It was a great experience. Appreciate it.
Perfect.
Awesome.
Our pleasure.
We're not letting you go just yet, Sarah. There's a few more questions for you. So I think we had a lot of questions come in, and I tried to, as we usually do, kind of pull them together into sort of common themes. So the first one is around social media. So you mentioned reducing social media as a way of kind of reducing anxiety. And this one particular quote says, "I find I like to binge on social media at the end of the day to zone out, like so many of us do," right? So why is social media so negative?
Oh, well, so I'll take the first stab there.
Crack at it.
Yeah, because in that context, if you are using it to zone out and escape, and it's, for a specific period of time, there's no difference to that than watching TV or, we talked about the flow state. If that's your flow state and you're kind of zoned out and you're winding down, great. Where it could be an issue is more if you're in the kind of algorithm of social media and it's throughout the day, you're checking it often, you're spending a significant amount of time, and you're not even really purposefully looking through it. You're just, whatever's popping up, and you're just kind of on there throughout the day, then that's more of an issue and can lead to increased anxiety for sure. But I don't have any particular issue with it to kind of chill or zone out for a short period of time.
Yeah, and I would totally agree. I think it definitely depends on the context of what you're looking at, right? If you're the rabbit hole of the negative media, news, that kind of stuff, that's feeding into your anxieties, that's one thing. But if you're in the scrolling through TikTok and laughing at the videos and the dances, that's another, right? Like, I think it very much depends on what you're looking at.
Yeah. And on that note, feel free to check out our new TikTok page. I think some of you may get a laugh at some of the videos.
At the dancing dog. Awesome. So another question has come in from a few people actually asking about what if you're not physically able to exercise? For example, if you have heart problems or some kind of illness that prevents you from exercising, what would you recommend?
Well, so it depends on how significant the impairment is. Exercising can be as intense as you want it to be, but also even just from the idea of even getting outside for a walk even. So without kind of knowing the extremes, I would just say if we're limited in our mobility, whatever you can do. So there's a ton of different equipment out there that even things like arm bikes, if we're not mobile with our legs, or even real low impact devices to work the legs. Certainly if you can get outside, we don't need a P90X workout, we just need some walking. And if we can't do any of that, then I would just say, even just getting outside, getting fresh air, and again, kind of tuning in and grounding can be beneficial if you can exercise.
That's when you need to start exercising the mind, right? Doing those kind of things.
Yeah, totally. And that is something, again, take home from tonight. If you can't exercise that body, exercise the mind and exercise the heck out of it then. And, you'll certainly benefit from that kind of a workout.
Mm-hmm. And then switching gears to meditation. So a few people have asked, have basically commented that they have trouble kind of sitting still and find meditation very difficult. Any tips on helping those people kind of get started and quiet the mind?
Sarah, do you have
and
any?
How to stick to it, I guess, because it is so easy to quit.
I've got like one thought, but if you have anything, Sarah, that.
I am someone that finds meditation hard. I have a hard time sitting still. You will never, yoga is not my thing, especially at the end of it, that stillness, that quietness, that's not me, right? I'm more someone that needs to be up and moving, which I think is okay, right? Because that's my relaxation. Sometimes maybe those headphones, maybe those earphones in there to kind of distract the things that might be around you from what's preventing it down. I think there's a lot of movement things where you can be out in nature and have kind of guided meditations and different things like that. It doesn't have to be stillness in your home, in your seat. It can be anywhere, right? So
great point. And that's where I was going to go with it too, was just like for me, I find the more I learn about meditation, the more I practice, it isn't that I have to be completely still. Everything has to be quiet. And, because that can be very hard. An interesting thing with meditation is if you just allow yourself back to the grounding, that is a form of meditation. And so if you just want to get comfortable with the idea of turning on all your senses, you can sit there and just listen to everything. Let that kind of take away from some of your thoughts. And then you can get on the move and meditate. Again, if meditation is more paying attention, listening, feeling, then certainly in nature, if it's not your thing, sitting still, get out, go for a walk through the woods, listen, feel, see everything. And that can be really helpful from a meditation standpoint as well. It doesn't just have to be sitting there.
Perfect. And then the last one is it's around oils. So it's more one for you, Blake, but and I assume the person is speaking about using oils for like anxiety or insomnia, but they ask, wondering about the frequency of using oils and is it okay not to be consistent?
It depends what we're trying to treat. If we're talking like an anxiety, generalized anxiety picture, if you have anxiety every day, again, if it kind of meets that diagnosis where you do need something, then taking it consistently would make sense. Again, morning and afternoon perhaps. But if it's more of a situational thing, or I only have this anxiety that needs to be managed when this day at work or when this event happens, you can use the oils as needed. I would say the majority of my patients, though, are taking it to manage anxiety daily. They're more the generalized anxiety, and they're usually dosing once or twice a day.
Cool. I think, everybody, I think we got to all of the questions.
Okay. Perfect. Well, I guess we will sign off, but before we do, thank you again, Sarah.
Thank you.
Okay. Meredith, thanks.
Pleasure.
And really everyone who joined, thank you. I really hope that this was useful, and you get a lot out of it, and we're all in it together. So again, don't feel isolated. Talk, keep the dialogue going. And if you need anything from us, just let us know.
I was going to say, actually, before you wrap up, there were several kind of questions that came in that were more like personal medical kind of questions. So just a reminder to anybody that, we couldn't get to those, but if you want to reach out to the office team can, obviously support you on those questions one-to-one. So
yeah, office, CMHA.
Yeah. A lot of them were specific dosing and things like that. So
okay. Yeah. Yep. Perfect. So that will do it. So good night, everybody, and hopefully we'll see you soon.
Night, everyone.
Thank you.
Thank you.
Bye.
Bye.
Thanks, Sarah.
Thanks.